Soundbytes. Quick clips, long-term learning.
All right, so this next case we have is a middle-aged man who came in, presented with shortness of breath and had a lot of abdominal distension. So the clinicians were evaluating for anasarca and ascites, and actually ended up doing a fast exam to look for any signs of a big fluid pocket that they could tap with a paracentesis.
Okay.
So we're looking here at right upper quadrant. What do you notice? Anything about this right upper quadrant?
Looking at the liver, we're looking for kidney below it there. Nothing really standing out too much on this one.
Let's take some more views here. One thing that I know they just didn't label, so just make sure you all label your views so we know what you're looking at. They got it on this one though.
All right.
Now we're seeing the little bit better view of the right kidney here on top of the psoas muscle. You can see a little bit coming into view in and out right here. Looking around the liver, anything of note?
Yeah, so we have some rib shadowing there, down like the central part of the liver. As we look towards the top right of the liver at the point there, apex of the liver, we see some fluid, like a small fluid collection there. Guess that could be any number of things: blood, bile, ascites.
Yeah, and urine potentially. There's no history of trauma in this patient, but with the abdominal distension that they were considering ascites. So let's take some more looks here. Now we're going to go through the left upper quadrant, and we're trying to get views of the spleen and the left kidney.
Okay.
So walk us through kind of what you're seeing here.
Yeah, so that the spleen is that organ on the top left. Below it, you are to the bottom right, you're looking for a kidney that doesn't necessarily look like the normal structure of a kidney. Right there, that circular mass type structure does not look like normal kidney structure, more so of like a mass.
Yeah. So this is definitely looks different than a normal kind of renal cyst, right?
Mm-hmm.
So renal cysts are usually anechoic and small, usually benign ones less than 5 centimeters. But you have this heterogeneous kind of solid mass-like structure in the area where the kidney usually is.
Okay.
And then you have some central clearing here, which maybe a small amount of fluid within it internally. So what do you think this may be?
If it's like a solid mass on the kidney, less likely to be some sort of cyst, and worrisome for a potential carcinoma or cancerous growth.
Yeah, exactly. So it was measured later on CT. It was 11.5 centimeters and was found to be growing off of the kidney. So concerning for malignancy, and got further workup that diagnosed renal cell carcinoma.
Okay.
We also see some other findings in the left upper quadrant. We see here the diaphragm, and then you see a little bit of fluid above that as well, so like towards the patient's head. So this is some pleural effusion as well, kind of wrapping around above the diaphragm. We see it a little bit better in this view as well. The teaching point for this case is just when you're doing any type of ultrasound exam, just be on the lookout for any incidental findings, because they will definitely change the patient's management.
Okay.
Soundbytes. Quick clips, long-term learning. This soundbite is a shorter, digestible segment taken from our monthly Soundcheck podcast. For the full episode, check out the podcast on YouTube at youtube.com/MedStar Emergency Physicians or visit mepsono.com.